Today, we are covering cardiovascular assessment for your NCLEX exam. The exam will test your ability to identify not just abnormal findings, but to determine which finding indicates the most severe or acute problem, requiring immediate nursing action. The test isn't about simply knowing the definition of edema. It's about recognizing that new onset crackles in the lungs of a cardiac patient are a higher priority than their chronic 2+ pedal edema. Let's focus on heart sounds. While you know S1 and S2 are normal, the NCLEX loves to ask about the abnormal sounds S3 and S4. An S3 sound, often described as a ventricular gallop, is a classic sign of fluid volume overload and is commonly heard in heart failure. Hearing a new S3 is a red flag. An S4 sound, or atrial gallop, is typically associated with a stiff, non-compliant ventricle, often seen in long-standing hypertension. The exam will give you a patient scenario and ask for your priority action. If you auscultate a new S3 sound in a patient complaining of shortness of breath, your priority is not to simply document it. It's to assess for other signs of fluid overload, like crackles or JVD, and prepare to administer a diuretic like furosemide. Another critical assessment is jugular venous distension, or JVD. This indicates increased central venous pressure and is a hallmark of right-sided heart failure. The NCLEX expects you to know how to assess this correctly. The patient must be positioned with the head of the bed at a 30 to 45 degree angle. Distension of the jugular vein more than 3 to 4 centimeters above the sternal angle is considered abnormal. A common exam trap is to present a scenario where a patient is lying flat and has visible neck veins. This is a normal finding and a distractor. The 45-degree angle is non-negotiable for a valid assessment. The exam will also test your ability to connect assessment findings. For instance, left-sided heart failure typically presents with pulmonary symptoms like dyspnea, crackles, and frothy sputum, while right-sided heart failure presents with systemic symptoms like JVD, peripheral edema, and ascites. A question might describe a patient with worsening ankle edema and JVD and ask for the most likely cause. You must immediately recognize this as right-sided heart failure. Remember this simple phrase to keep the assessment priorities straight: circulation before documentation. When you find a critical sign, like absent pedal pulses in a post-cardiac catheterization patient or new onset JVD with crackles, your first action is never to just document. The correct answer will always involve a direct nursing action, like notifying the provider, assessing for further signs of compromise, or preparing for an immediate intervention. The NCLEX is a safety exam, and your assessment must lead directly to a safe and timely action. Don't let stable, chronic findings distract you from acute, life-threatening changes.